Welcome to the National Women's Fitness Academy podcast. We're here to talk about women's health, female hormones, body image, and all things health and fitness. Hi and welcome to episode 1. Today we're going to be talking about endometriosis. Being March, it is Endometriosis Awareness Month, so we thought it was fitting to start off this podcast with the topic. Today we are really lucky to be talking to women's health and natural fertility expert Jacqui Lamplugh. She's really passionate about educating women about their hormones and teaching them that their period is not something to be scared of, it's not their enemy. Her qualifications include a Master's in Reproductive Medicine, Bachelor in Health Science in Complementary Medicine, Advanced Diploma in Health Science in Naturopathy, also 10 years clinical experience in practice, and is also the author of The Honest Hormone Handbook, which is a really, really awesome book. So we're so lucky to have Jacqui on here today. Yeah, so you've already helped so many women with their fertility and hormones and things like that. And can you tell us a little bit about yourself and why you like doing this?
Thanks, Lauren, and thank you so much for having me on the podcast today. Very excited to be number one in the first podcast session. So a little bit about myself and how did I get into women's hormones when everyone just wants to try and avoid their hormones. Really mainly I read a book when I was about 18 and it was called Natural Fertility, and after reading it, it was just one of those books that you can't put down, and I was just like, why has no one ever taught me this? And it was just one of those big aha moments, because I'm not sure about you, but sex ed really failed me when it came to my body and my periods and knowing how everything works. So from really that moment on, I was just like, I have got to share this with other women. And that's where I went on to study naturopathy, and then went on to do my Master's in Reproductive Medicine, just to help other women understand their bodies and get pregnant.
Yeah, right. We definitely weren't taught much about it in school, and it's really like you don't realise until you're a bit older and you start having like little issues or not knowing what's going on, and then you think, why are we not taught this? But luckily it's starting to get more awareness around all these issues that we might have. So yeah, it's a really good prospects for women in the future. So let's get into endometriosis. Being Endometriosis Month, it's one of those hormonal illnesses, I guess. I don't know what the proper term for it is, but if you could tell us a little bit about what it is, that would be great.
Yeah, absolutely. So endometriosis definitely is only affects women of menstruating age because it is influenced by our hormones. But there's so much more to endometriosis than just hormones, and I think that's what can make endometriosis quite complex in regards to treatment and quite complex in regards to diagnosis. So endometriosis is a situation where our endometrial-like tissue grows outside of the uterus. So our endometrium is what grows inside our uterus, and it grows and sheds each month in response to our hormones. So that's what we shed when we get our period. Now, with endometriosis, we say it's endometrial-like tissue because it's not the same as the tissue that grows in our uterus, but it's very similar. It's still under the influence of our estrogen particularly, but under the influence of our hormones, so it will kind of grow and flare up in response to them. But it contains its own set of hormone receptors, and it reacts slightly differently to our hormones and inflammatory molecules than, say, our endometrium. And also with that, the issue with it growing outside of the uterus is that it's very inflammatory, and that's why we see a lot of pain. But if you can think of it a little bit like a grapevine or like a kind of creeper-like plant, it'll just kind of grow and infiltrate into other tissues. So it can then start affecting the ovary, your fallopian tubes. It can start affecting your bowel and your bladder. And it's quite common to get what we call adhesion. So that's just kind of that grapevine growing and attaching your uterus to your bowel. or attaching to your ovary, so your ovary can't move anymore. And it can also cause cysts on the ovaries that are known as endometriomas. And you can imagine that if everything's starting to be entangled with this vine-like structure, then it can be quite painful in that area. And you're going to have issues with intercourse, with your menstrual cycles, being able to have bowel motion, or even going to urinate at the toilet.
Yeah, it sounds really painful, and it's one of those things that I think in the past has been passed off as just a bad period, but it's I think we've learned more recently that your period actually shouldn't be very painful. It's not normal and there's something going on. I had a few people writing to our Instagram about how it feels to have it. One of our followers, Olivia, who actually has adenomyosis, which is similar, and also endometriosis, I think. So she said, it feels like you're being stabbed with a knife from the inside out, like you're a zombie, and you get brain fog and you're very lethargic. So yeah, very painful there. Paige wrote, it's fucking shit. It's not always just the pain. You tend to numb that out sometimes. It's the mental pain as well. So it's like a bit of a theme there that it does affect your mental health as well. Is that like the hormones doing that, or is that, I guess, the pain, or a bit of everything?
I feel it's a little bit of everything, because definitely the pain is a big issue. And the interesting thing with endometriosis is the pain doesn't necessarily instigate the degree of severity of the endometriosis. So someone could be in excruciating pain and have very mild endometriosis, where someone could have quite advanced endometriosis but have very minimal pain. So we can't kind of, judge a woman on her degree of endometriosis and what she should be experiencing, because everyone experiences something different. But absolutely, it's a horribly painful condition, and just having to live with pain and the knowing that you've got, a diagnosed condition can play a huge impact on your mental health. With endometriosis too, there's a big inflammatory component, and we know that inflammation really affects our brain and how it functions and our neurotransmitters. So it's really something that we used to look at as just a hormonal condition, and we now have to stand back and go, no, we need to take a holistic approach, because if we just treat the hormone side of things, we're not going to give those women the results that they deserve. We need to look at it more holistically. We need to look at the systemic or that chronic inflammation. We need to look at their energy levels, their mental health, the immune disruption that's going on, and try and give work on all of that to help them to have a much more enjoyable life.
Yeah, I've heard it can take a really long time to get diagnosed. If someone thinks that they might have this condition, is there sort of a way that they can fast track that, or is it just a really long process?
Yeah, and I feel that that's why Endometriosis Month has come about, to try and bring more awareness to the condition so we can fast track diagnosis and really kind of just highlight the fact this is a big issue, and it's affecting a lot of women who are going undiagnosed and not getting the treatment they want. So on average, yeah, you're right, it takes about 7 to 10 years for women to get diagnosed, which is crazy to think they're struggling with all this horrible pain.
It's a long time.
Yeah. And I think some of the reason around it taking this long is because a lot of the time women will go to their healthcare provider with period pain, and they'll just be kind of shrugged off and said, oh, well, that's just part of being a woman. But period pain is common, but it's not normal. Like, it's your body telling you that something's not right. So a lot of these women are just told, just take this drug, or, just suck it up.
We're told to suck it up a lot.
I know, it's such a shame, isn't it? And it's not really until they're starting to try and get pregnant that someone actually takes them seriously. And so if they haven't, for a lot of women, they'll try and get pregnant, can't fall pregnant, or haven't fallen pregnant within a year, and they'll go see a fertility specialist, and then they're going to start doing some more investigations and find out, oh, well, we've actually got endometriosis. So we're fobbing off these women when they're in their younger, not interested in starting a family yet. And it's not until they're actually struggling to get pregnant and going through all that heartbreak that actually someone sits down and takes them seriously.
Yeah, definitely.
I think that's the most disheartening thing. So really, if you feel that you may have endometriosis, I would be really kind of pushing the point with your health care practitioner and just going in there quite informed as well. So obviously, endometriosis cannot be diagnosed by a blood test or ultrasound.
Yeah.
It can only be diagnosed with what's known as a laparoscopy. So when they actually go inside and have a look on what's going around the uterus and the ovaries and things like that.
So that's like a keyhole surgery, is it? Like they go in and have a little look and see. Yeah, yeah. So it can't actually be, you can't actually see it from a scan or ultrasound or anything. It's just, you have to actually go in and have a deeper look, which is why it probably takes so long as well, because that, I think is their waiting list and just processes to get to that point.
Yeah, there's definitely processes, and I think we're always, when treating people, always trying to be as least invasive as possible. But if you really, really feel that you've got endometriosis, just be confident and ask. And just keep finding a healthcare provider, a doctor, a gynecologist. Just keep looking until you find someone who actually will listen to you. Don't be afraid to get another couple of opinions if you feel like you're being fobbed off.
Yeah, one of our Instagram comments, Kiera wrote, don't ask your GP to check for it. Tell them you have it until they prove otherwise. So that's a good one. So don't get fobbed off. Don't just keep asking and not getting the questions answered that you want. Olivia wrote, see a naturopath that specialises in females. And Jess wrote, never stop seeking answers. Don't give up until you know what's wrong. And another one that is common is, Kira wrote, contraception does not cure endometriosis. It hides the symptoms, and endometriosis will come back with a vengeance. So is the pill something that's often prescribed to people that come in with period pain and period issues, and it's not actually helping it, maybe making it worse?
Yeah, it is. And you kind of talk to anyone, especially like, our generation older, who's gone and seen a doctor for period pain, and they'll just say, "Oh, just take a pill. You'll be fine. We're not going to do anything more." So yeah, that is a common, just fob off, just take a pill. But no, it's not. It's going to mask it, and we've got to remember with the combined oral contraceptive pill, that contains estrogen in it, and we know that endometriosis is aggravated by estrogen. So it's definitely going to mask the symptoms, or for some women it can actually even aggravate it. And once you stop that pill, then absolutely you're going to have to still deal with the endometriosis. Some women who do have endometriosis choose to go on hormonal contraception to help manage it. And in that case, usually I recommend like the Mirena, or just the contraceptions that contain only progestin and no estrogen. To help manage and make life more manageable, which is totally fine. But yeah, I wouldn't kind of encourage someone just taking it just for the hell of treating the endometriosis, because it's just going to mask it, potentially make it worse. Find out exactly if you've got endometriosis and make sure you get a diagnosis first. And then once you know, you have so many different options on how you want to treat it. Do you want to go down the medical route and treat it with a laparoscopy or with hormonal birth control, we'll call it, but hormonal drugs? Or then did you want to kind of try and treat it naturally and help reduce any flare-ups or it aggravating again? Because what we've got to remember is laparoscopy surgery is the gold standard for treating endometriosis, where they go in and they scrape all the tissue away and remove the adhesions, and that helps reduce the inflammation and a lot of the symptoms that women experience with endometriosis. But the endometriosis is kind of going to grow back.
Okay, so it's going to grow back. Yeah.
Plan on how are we going to manage this condition for you? What are we going to do to help prevent it growing back? or at least slowing that rate of grow back. And then if we can do that, then we can also manage your symptoms at the same time.
Well, so going from that, is there a cause of it, or are there causes of endometriosis, or is that still not understood completely?
Yeah, it's still not understood completely. There's a lot of ideas on what causes it. For a long time, there was thought that there was what they call retrograde menstruation. So instead of your menstrual blood coming out of your vagina, it's kind of actually spouted out and come through your fallopian tubes and entered into the abdominal cavity. That was a long-standing idea of what was going on, but I feel more so in the last 5 or so years that's starting to be debunked a little bit. There's thoughts that it might be an autoimmune condition because it has some similar markers and reacts very similar to autoimmune disease. We're still definitely trying to find out what the cause is. Whether we find it or not, we're definitely learning a lot more about the best ways to treat it, because once we moved from it being just a hormonal condition to, okay, actually we've got immune system issues, we've got chronic inflammation, that's when we start seeing better results in the clinic.
Okay, so they can get the surgery to get the tissue removed, and then in between that time, is there a normal time frame that it might grow back, or is it different for everyone?
Yeah, it's different for everybody, and definitely it depends also on the severity or the aggressiveness of their endometriosis too. Like I said, some people can have quite advanced endo but have very little symptoms. So yeah, it's how long is a piece of string, unfortunately. But I think the empowering idea is that there is a lot that you can do yourself to help reduce and slow its growth again.
Yeah. So a lot of like lifestyle things, can that help? And is there like natural remedies and things like that you can do instead of the pill, or as well as hormone treatments, or what's sort of the best way it's been done that you have seen?
And that's a really nice point you made too. Like, it doesn't have to be this way or that way. You can incorporate the best of medical, natural medicine, lifestyle diet, which is really nice to have that holistic approach. So when treating endometriosis, there's 5 different areas that I really focus on in regards to treatment. So the first one is trying to reduce that chronic inflammation, because that's just like going to aggravate everything. So that's one of the big areas I'll address, is trying to reduce inflammation. The second area is stabilising the immune system, because there's very similar to autoimmune component. We really want to help with that immune balance. So that's where we can look at making sure you've got adequate vitamin D levels, making sure your zinc levels are adequate, checking your stress levels, because stress will have a really big impact on your immune system. Looking at your exposure to endocrine disrupting chemicals. So they're known as EDCs, and they are chemicals that we find in our cleaning products, our beauty products, our personal care products, and the chemicals act like estrogen within the body. So they'll mimic the actions of estrogen, and studies have shown that women with endometriosis have higher blood levels of BPA, phthalates, and dioxins. So definitely, if you are struggling with endometriosis, being really mindful of those 3 chemicals and your exposure to toxins. So changing out your personal care and makeup to more natural forms, avoiding plastic as much as possible. So BPA is found in plastic. So only drinking out of glass, don't heat food or store hot food in plastic, and even washing your hands after touching like a receipt from a till, because the ink contains BPA. And phthalates are smells. So, ditch your fabric softener, because that's full of phthalates. The garbage bags you get, and they're like lemon scented.
Yeah. So many things that you wouldn't even think about that can, get absorbed into your body and can affect your hormones. It's amazing. So the smells, touching ink and the fabric softener. Is there what other things?
Using organic feminine care products, so like your tampons and your pads, because that dioxin that we talk about, we often see in quite heavily bleached cottons, and so your conventional tampons that'll be in there. So always making sure they're organic. But yeah, so just, and fake candles and not spraying perfume. They tell you to spray perfume here and here.
Yeah.
And so spray, I love my perfume. I can't change it for a natural one. I don't know. So I just spray it on my clothes because then I don't absorb it into my skin.
Yeah, that's amazing. You think, you spray the perfume on your neck and your wrist, and that's just going to go straight into your bloodstream. And that could be one of the things that's impacting your hormone cycle, which is just mind blowing.
It is.
Yeah, it's sort of like gives you that perspective on why there are so many women with this condition. I think it's something like 1 in 10. Is that like more recent data? Is it gone up, or is it just not been documented in the past?
My understanding is the 1 in 10 is the most recent figures that we have. Is it going up? I think it's going to be very hard to say. Yeah, absolutely. We've got more diagnosis of endometriosis than we did like 30 years ago. But I think that's because we're getting better at diagnosing it and acknowledging it.
Yeah, for sure. Yeah, wow. So in terms of lifestyle, like you talked about reducing those toxins in your products, what about, is there like a diet or something that you can do in your lifestyle and exercise and things like that? How does that help endometriosis?
Yeah. So with diet, that's a big player because we really want to look for more an anti-inflammatory diet because in endometriosis we have so much inflammation. So having lots of those anti-inflammatory fats like salmon and walnuts and chia seeds are going to be really important. Lots of dark green leafy veggies and lots of fibre. There's been a lot of studies linking gluten and endometriosis. So one study got a group of women to cut out gluten completely from their diet for a few months. And what they found with that group of women is that about 80% of those women actually felt an improvement to a reduction in their pain from going gluten-free. And the women who didn't notice any reductions, they didn't notice that their pain got worse.
Okay.
So the idea is that if you are struggling with endometriosis, it's probably recommended to go gluten-free to help potentially reduce the pain. And we know that gluten is very inflammatory to the body as well. So it can also help reduce that inflammation that's going on. And again, with that, often a gluten and dairy-free diet is recommended for women with endometriosis to reduce that inflammation. But again, just, kind of tailoring it for each individual is also really important. Some women are quite sensitive to dairy, and it can be an issue for them, while other women with endometriosis feel that they can have a little bit. So I think it's a real trial and error. Take it out for a month and see how you feel. And if your symptoms do improve, then that's working for you. The other thing we need to consider is that we need to support estrogen clearance because we know estrogen aggravates endometriosis. So we want to make sure we're having a bowel motion every single day. So we're getting rid of the estrogens out of our body. You want to be trying to eat 30 grams of fibre because, again, that's going to help clear any excess estrogens out. And lots of broccoli, cabbage, Brussels sprouts are beautiful at detoxifying estrogen. So making sure you're boosting up your diet with that. Exercise, of course, is always really important. And we've got to remember for the mental health component as well.
It's for sure.
Be important for that. More endorphins from exercise is going to also help with your ability to handle the pain and your pain resilience. And I've been asked before, what kind of exercise, are there any exercises I shouldn't do with endo? There isn't a hard set rule about exercise and endo. Definitely exercise is important. But if you're not sure, speak to someone who's trained, like a PT trained in endometriosis and women's health, or even a women's health physio, because it depends on where your pain is or, what organs are being affected by your endometriosis on what exercise are going to be better.
Just having someone that understands it. That's why our course, we teach our personal trainers about these conditions, because you can help your clients not only just by understanding it and knowing what it is. You can see if they're sort of guarding their tummy, and maybe you shouldn't get them doing those heavy squats because they might hurt their back. And just looking out for those little things that, the guarding of the abdomen and things like that, not making them do heaps of like box jumps or, crunches and really heavy compound movements. So just those practical things. There's heaps of practical things there that you gave, that anyone could take on board. Just so interesting that because endometriosis is can be flared up by high estrogen, you can detoxify that estrogen by having a high fiber diet and including those green leafy vegetables, reducing the gluten, or cutting that gluten out of your diet, which is also can be an inflammatory thing for people. So such practical and great advice. One of the other questions that I got on Instagram was, if you get ovulation pain, is that a sign of endometriosis, or is that something that's normal?
It can be, but it doesn't necessarily is. So definitely women with endometriosis do report ovulation pain and pain at different times of their cycle. But if you're getting ovulation pain, don't automatically think you've got endometriosis. You need to kind of tick a few of the other symptoms of endometriosis, like painful periods and painful sex, pain when you're going through bowel motion, spotting or bleeding at different times of your cycle, so those kind of things as well. But if you are experiencing ovulation pain, you can start trying some of the dietary and lifestyle recommendations that we just spoke about before, because often ovulation pain is in response to that spike in estrogen at ovulation, and in combination with that you get this spike in inflammation. So looking at an anti-inflammatory diet, increasing your fibre, making sure you're exercising regularly, all those things are going to help treat the ovulation pain as well.
Yeah, well, I'm going grocery shopping after this now. I've got to go get my green leafy vegetables and my gluten-free bread, because, it's just, inflammation. I suppose you can get it even if you don't have these conditions, and it can affect you, your bloating and things like that, and your skin. Can you have all these symptoms and then not have endometriosis, or is it something that is probably do have it, or Yeah,
you absolutely can. So especially when it comes to period pain, not all women with period pain have endometriosis. So if you are experiencing period pain, pain with sex, discomfort when you're having bowel motions, or kind of irregular spotting with your cycle, make sure you do go and get it investigated, because these are all signs that something isn't right. It may be endometriosis, but it may also not, because there's different things that, cause period pain and things like that. So it's really important that if you are getting these symptoms, to make sure you go and speak to a healthcare practitioner and get it looked into, because your body's telling you something's not right. So it's time that we listen to them.
Yeah, for sure. I'll get to some more of these comments. So Ashton wrote, it feels like your uterus is going to fall out during your period and you're losing cups of blood at a time. So is that one of the other symptoms, is losing a lot of blood, or is that something that some women maybe experience?
Yeah, heavy periods is definitely a symptom, and a period with lots of clots in it can be a symptom. I honestly take my hat off to these women with endometriosis. They definitely deserve the title of an endo warrior, because what they go through when they get their period is insane, and they're just some of the strongest, toughest women that I've met.
They definitely are strong, and I know a few people that suffer from it, and they still, they have to get up and tend to their kids. They have to go to work or school, or everything like that. And it is definitely a lot harder than it is for people without it. So hats off to them for still getting out and doing, doing life. Yeah, for sure. I guess to wrap it up, like, is treatment of endometriosis something that you could help women with if they wanted to come to you?
Yeah, absolutely. I do treat quite a few women with endometriosis, both women trying to conceive and women who are not trying to conceive. And yeah, more than happy to kind of work with women wherever they're at. Some women I work with and they are on a form of like hormonal support. And what we're doing is building those foundations to help, reduce inflammation and balance the immune system, and make life a lot easier for them. And then there's women who don't want to go down that hormonal, synthetic hormonal support avenue. And then, so we're trying to tackle it from, treating the cause and treating those symptoms and making life a lot more manageable. So yeah, more than happy to work with women for wherever they're at with their endometriosis journey.
Yeah, awesome. Yes, it's great to know that there are female specific naturopaths out there helping so many women with these conditions. So you help women with their fertility every day. I see posts all the time where someone's gotten pregnant after being your client. I think that must be such a great feeling.
Oh, it is really very exciting. And I also have to just say kind of how grateful and honoured I am that they let me in on this journey, because, you're a mum as well, so you know how secretive that whole trying to get pregnant and, those first 12 weeks of being pregnant are, doing everything you can to like look normal, but
yes.
trying to keep it right. So it's really such an honour and like really special that someone lets you into their inner circle and allows you in on that kind of journey. And when, I'm usually like the second person to find out after their husband. So, oh my goodness, it gives me like goosebumps. And just knowing what some couples have been through, it's just, so excited when they finally get that, big fat positive.
That's awesome. So what is the best advice that you've ever been given?
So much advice. Probably the asking the question of what can I learn from this, or what did this teach me? So when you kind of something hasn't gone your way, or you've had a bad day, or you're not kind of feeling great about a situation, or didn't get that job, and just kind of standing back and going, okay, so what can I learn from this? And I find it really helps you move from that victim mentality to a more like empowering position on going, okay, this is just a step in the journey.
Yeah, I love that. So there's no failures, there's just lessons. Absolutely. Yes. And what is the biggest assumption that people make about you?
That I am younger than I am.
Yeah, that's a nice one to have, though. you do look very young.
I remember I was like starting out as a naturopath, and I was like just young, and you want to be taken seriously, and everyone's like, "Are you even old enough to do this job?"
Yes.
And I'm like, yes, I am.
You've been You've been treating people for over 10 years. I guess I met you at Curtin University. It was over 12 years ago. I can't remember now, but that's a long time.
And isn't it funny how like our lives have gone? Like we met studying ag, and now look. Yeah.
I know, absolutely, yeah. So for those who don't know, I met Jacqui at Curtin University studying agriculture, agribusiness, and then Jacqui went off to study medicine and naturopathy, and I completed my studies, but then went on to journalism. So and now starting the National Women's Fitness Academy, got into fitness, just because there wasn't enough help there for women in the industry, I thought. So it's so lovely to connect with so many like-minded women and try and hopefully help more women out there. So I really hope we have helped anyone out there, and if anyone has any more questions or anything like that, then feel free to give myself or Jacqui a message, and we can continue the conversation if there's anything that wasn't answered or anything like that, I guess. Is there anything you'd like to finish on?
No, just a big thank you for having me on, and well done on starting a new podcast, and I just love the work that you and the whole Academy are doing on just helping women feel comfortable and more empowered with their health. So well done.
Yeah,
and
absolutely.
I'm so looking forward to seeing your podcast evolve.
Thank you so much. Thank you very much for being a guest on this. And yeah, we'll speak to you soon.
Lovely.
Thank you for listening to the National Women's Fitness Academy podcast. I'm your host, Lauren Kelvin. We would absolutely love it if you could screenshot and tag us at Instagram at womensfitnessacademy_Oz. If you'd like some more information on how to become a master female trainer, head to www.nwfacademy.com.au.